My life with uterine fibroids was basically staying close to home, really not being able to do the things that I like to do, wearing dark clothing, not being able to really hang out with my friends, hang out with my family as much as I wanted to, due to having to always think about if I was going to have an accident.
Uterine fibroids are benign growths that are extremely common in the female population. They're the most common tumor in all of humanity. They're not malignant, and no one really knows what causes them. We do know that they are stimulated by hormones. Most common symptoms of uterine fibroids are vaginal bleeding, cramping, prolonged menstrual periods, irregular menstrual periods, and occasionally, if the fibroids are large enough, they can cause constipation and urinary frequency.
Having fibroids prevented me from basically doing the things that I love to do, taking long walks in the park, hanging out with my sister, hanging out with friends and family. We're a very active group, so I would center my life around my menstrual cycle, making sure that I was always close to home during that time of the month. So it kind of limited my social life. I found out about uterine fibroid embolization from my primary care doctor. One day at work, I had a sharp pain that kind of stopped me in my tracks, and I knew something was wrong. I set an appointment the next day. She gave me a CT scan. She saw the fibroids, and we went from there trying to find someone that could remove the fibroids.
Uterine fibroid embolization is a minimally invasive procedure where a patient is taken to the fluoroscopy unit, and we gain access to one of the femoral arteries in the thigh to essentially embolize or cut off the blood supply to the fibroids, which then forces the uterine fibroids to shrink. Uterine fibroid embolization has the advantage in that it has the ability to treat all the fibroids that are within the uterus. That includes the fibroids that are still small and will not present until a few years later, but also the larger ones that are causing problems and causing current symptoms. Uterine fibroid embolization also has the advantage in that it preserves the uterus. It does not require surgery or hysterectomy.
I met Dr. Shaheen. My interaction with him was wonderful. He was actually very calming. He made me feel really relaxed the day of the surgery. He came in, he told me what to expect, what was going to happen. He really assured me that everything would be okay. He took a look at my scans and just felt confident, and his confidence made me feel more relaxed, which was wonderful. Some people think the only option is a partial hysterectomy or a hysterectomy, and that's not true. You have this great option of the UFE, the downtime from 6 to 8 weeks with a partial hysterectomy or a hysterectomy opposed to a couple of days and you're back at work. My life has changed since having the procedure. I feel like I can now live again. I can go on long walks. I can hang out with my sister. I don't have to schedule things around my cycle. I'm free to wear white or tan pants. So I just feel like I'm living again because I had stopped living before.